Okay, good evening, ladies and gentlemen. My name is Xiao-Quan. I'm from the First Affiliated Hospital of Nanjing Medical University. Today, we want to introduce one recent paper published in JMI Journal. The title of our research paper is T2-weighted MR Imaging-Derived Radiomics for Pretreatment Determination of Treatment Response to GC Therapy in Patients with TAO, Comparison with the Semiquantitative Evaluation. As we know, the TAO is a very common optic disease in clinical practice. It contains two distinct disease processes. It contains the active phase and the static fibrotic phase. And for the treatment of active and moderate to severe state of TAO, the first-line treatment is systematic GC therapy. However, the overall response rate of GC therapy is only about 70% to 80%. Previously, a lot of researchers want to determine the treatment response before GC administration. Firstly, they used the clinical markers to predict. They found the TRAB, disease duration, smoking history might be helpful, but no agreement was achieved. Some radiologists want to predict the response using the morphological measurement or the T2 best histogram analysis. However, the overall performance was limited, and more importantly, they ignored the heterogeneity related information. Recently, the Radiomics analysis who can evaluate the tissue heterogeneity very well attracted more and more attention. The Radiomics analysis has been proven to be useful, to be promising in evaluating the optical disease. Therefore, the purpose of our study was to investigate the value of radiomics based on baseline T2-weighted imaging for determining the treatment response before GC treatment in patients with active and moderate to severe TAO, and to compare its diagnostic performance with that of semi-quantitative image features. Okay, this is a flowchart of our study. 170 patients with active and moderate to severe TAO patient was found in our database. According to the inclusion criteria of present study, 110 patients with 220 involved eyes were enrolled. This is the clinical assessment. We connected the disease duration, disease activity, disease severity, and for all the TAO patients, a standardized the intravenous GC therapy was used. According to the treatment response, the study cohort was divided into responsive and unresponsive group. And then the study cohort was divided into the training cohort and validation cohort. In the training cohort, 78 patients with 156 involved eyes, and the validation cohort included 32 patients with 64 involved eyes. All the patients underwent the optical MRI scan using a 3 Tesla MRI systems. The corneal T2-weighted image with fat separation was used for measurement and analysis. During the image processing and analysis, we first performed the semi-quantitative evaluation of T2-weighted image. The image parameters included SIR maximum, SIR minimum, and SIR mean. And during the radiomics analysis of T2-weighted image, the volumes of interest was placed on the corneal T2-weighted image. And reproducibility analysis, MW, test and lasso regression was used to obtain the radiomics features. This is a statistic analysis method. And we used 3 different machine learning classifiers, including the logistic regression, decision tree, support vector machine, to establish the 3 different radiomics models. The diagnostic performance among different models was compared using the Delon test. This is the result. Firstly, we could find in both the training cohort and the validation cohort, the unresponsive group showed significantly longer disease duration than the responsive group. And we also find the SIR median differed significantly between 2 groups. And finally, 8 radiomics features were obtained. And we then use 3 different machine learning classifiers to establish the 3 different radiomics models. When compared with the SIR median, we could find in the training cohort, the LR-best, DT-best, and SVM-best machine learning classifiers radiomics models all outperformed the SIR median in differentiating the responsive from unresponsive groups. In the validation group, only the LR-best radiomics models outperformed the SIR median in the differentiation. Then, combined the LR-best radio score and the disease duration, we established a nomogram. The RC analysis, the DCA analysis indicated that the nomogram combined the LR-best radio score and the disease duration might be useful in predicting the response. Now we make a conclusion. In our study, we found that the T2-weighted imaging-derived radiomics of LMs showed better diagnostic performance than SIR median, particularly when the LR-best classifier was used. The T2-derived radiomics, together with the disease duration, might be a non-invasive and effective approach in the pretreatment determination of treatment response to GC. Our study result would help the radiologist and the clinical doctors to establish the optimized treatment decision for the patient with active and moderate to severe TAO. That's all. Thank you.